Hello, I'm Irvine Mayor Christina Shea. I hope you're staying safe and healthy at home and only going out if it's absolutely necessary. Practicing social distancing when you must go out continues to be a critical importance as we work together to slow the spread of COVID-19. Today, I am joined by Vice Mayor Mike Carroll, our Police Chief Mike Hamel, and the Director and Founding Dean of the Public Health Program at UCI, Dr. Bernadette Boden-Albala. We are calling on Irvine residents and businesses to take even more aggressive measures to protect our community. On March 24th, the Irvine City Council passed an ordinance urging retail and service businesses to issue personal protective equipment to their employees. To aid in that effort, on Saturday, March 28th, I was joined with Vice Mayor Carroll, Councilmember Kuo, Councilmember Khan, and community volunteers as we delivered face masks to all grocery stores and pharmacies in our city. I would like to thank our Chinese community for donating 8,000 face masks to these critical services, as well as our city hospitals and to our first responders. Beginning Wednesday, April 8th, under direction of the Emergency Disaster Council, the City of Irvine will require all retail staff and clerks to wear face masks in their grocery stores and pharmacies. Based on the construct of how people interface during the checkout process at retail locations, it is nearly impossible to adhere to the 6-foot safe distance protocol, making this new face mask covering requirement a necessity. We would also like to emphasize the importance of store visitors wearing face masks as well for the protection of yourself and for the protection of others. The California Public Health Department, the Orange County Health Department, and the CDC have also issued guidance on cloth face coverings for the general public. These masks could help slow the spread of this virus, so I am requesting all of our residents follow the guidance of the federal, state, and local officials by staying home, practicing social distancing, and performing proper hand washing. You can find more information about face masks and other safety protocols on our city website. However, there is good news on this front. Several media reports cite evidence that early stay-at-home orders in California are having a positive impact and could help us avoid overwhelming our healthcare system. So I would like to thank Governor Newsom and Orange County Supervisors Don Wagner and Lisa Bartlett and my city council members for their leadership in this effort. I know many of our first responders and dedicated hospital staff and doctors are in the need of childcare as well. The city has recently partnered with childcare agencies throughout the county to survey providers to identify those that still providing care. We now have a list posted on the city's website with at least 20 childcare providers right here in the city of Irvine. Under my leadership and with the assistance of our Economic Development Manager, Caitlin Wynn, we remain committed to providing helpful resources and information to assist during this pandemic. The Small Business Administration is currently providing 2 essential financial resources for businesses that are in need. First is the Paycheck Protection Program, and it can be used to cover payroll costs, while the Economic Injury Disaster Loan can be used for non-payroll expenses. We're getting great feedback from local businesses signing up for these programs. And as we all know, our economy is dependent on successful small business owners. Therefore, I encourage you all to support our small businesses during this critical time by ordering delivery or takeout from a local restaurant. You can find a list of these food options on our city website, along with information about deliveries and discounts. And finally, I want to thank all of our community partners who are helping to maintain critical services. I first would like to thank our Public Safety Department, the Orange County Fire Authority, and all of our first responders for your heroic efforts. I want to thank also our doctors, our nurses, our healthcare professionals for your courageous care of our residents who are affected by this pandemic. I also want to thank our partners at the Irvine Unified School District for their quick transition to distant learning. Thank you to our grocery stores, our pharmacies, and retail businesses for leaving your families so that we can provide for our own. Thank you to everyone who helps to keep our city operating, including utility workers, landscapers, our road maintenance team, park staff, and our waste management partners. And I want to thank our city personnel for your sacrifices during this time to keep Irvine active. It's very much appreciated. Let me introduce Vice Mayor Mike Carroll, who would like to share some additional efforts that we are implementing in the city. Vice Mayor Mike Carroll.
Thank you, Mayor Shea. I am Mike Carroll, Vice Mayor of the City of Irvine. First off, if you are in need of assistance, please contact our COVID-19 hotline for Irvine residents. That number is 949-724-8250. Again, our COVID-19 hotline is 949-724-8250. If you're in need of help, do not delay and please call us. We are here to help you. I would like to share some important information with you about our community facilities and our parks. We are urging residents to stay home and self-isolate as much as possible. We are encouraging passive recreation activities to stay healthy, and passive activities include walking, running, hiking, and biking. Sports like basketball, tennis, soccer, and anything that requires physical contact are strongly discouraged. Our parks and our open spaces and our trails are all open, but they are open for passive activities only. Please use them as you need, but when you do, continue to practice safe social distancing. We have received reports that some people aren't following these guidelines. Please know it does not please us to put these guidelines in place, but they are for your safety. It is important to follow these guidelines of our federal, state, and city authorities, because we are all in this together and each of us plays a part in stopping the spread of the coronavirus. Sporting fields and tennis, basketball, and other courts are all closed until further notice. We have removed tennis nets and pickleball court nets. We have blocked basketball hoops with wood. Baseball and softball fields are closed. Again, we apologize for having to take these measures, but we are closing these facilities in an effort to protect the entire community from the spread of the coronavirus. We will have city staff members and our police department on site and conducting checks and patrols to ensure that people are following the proper protocols to keep us all safe. Please, please follow these guidelines. They are for you. To help keep our city active and engaged, we have launched a virtual community center, and you can find it at the website below. This site includes resources from government agencies, educational institutions, and nonprofit organizations, including activities that can be joined right at your home. This resource will continue to grow in the coming weeks and is included as part of our City Council's emergency response to COVID-19. Our Great Park Farmers Market has been modified to drive-through only. This is a wonderful way to support local businesses and farms and to get the produce and items that you need from the comfort and safety of your vehicle. The farmers market takes place each Sunday from 10 a.m. to 2 p.m. My city council colleagues and I continue to monitor the ever-evolving situation regarding the coronavirus. We must all do our part to stop the spread of COVID-19, and I would ask each of you to please stay home to prevent the spread of this virus. I am Mike Carroll, Vice Mayor of the City of Irvine. We will work nonstop to provide information and to help people. We will work to bring down the anxiety and bring down the fear. And remember, we are Irvine. We are united, and we will get through this together as a community. And with that, I would like to introduce the Chief of the Irvine Police Department, Chief Hamel.
Hi, I'm Irvine Police Chief Mike Hamel. Over the past few weeks, we have heard from experts and discussed at length all the ways we can protect ourselves and others by doing our part to slow the spread of this horrible virus. As of this moment, the confirmed cases of COVID-19 in Irvine stands at 77. Scientists project that this number will continue to grow until we reach a peak sometime in the next 2 to 4 weeks. This means it will get worse, perhaps much worse, before it gets better. We've asked our community for voluntary compliance with the governor's stay-at-home order. For the sake of your safety and the safety of your loved ones, please stay home unless engaged in essential activities. If you do need to leave your home, please continue to practice social distancing techniques. As you know, the stay-at-home order does allow you to go outside to exercise. Please continue to enjoy our trails and city parks, but only if you can maintain social distancing. I would like to remind you, however, that some recreational areas are now closed. This includes all city fields, basketball courts, and tennis courts. Please adhere to all signage and stay out of any closed area. Trespassing, cutting locks, and acts of graffiti will be investigated as criminal violations of relevant penal codes. As we messaged last week in a post on our social media platforms, we are experiencing a new way of life. Now more than ever, we must look for ways to communicate effectively with one another and safeguard the mental health of every member of our community. The Irvine Police Department is here for you in case of an emergency, criminal investigation, or other matter that requires a police presence to keep the peace or maintain public order. Many of you are aware of our mental health outreach unit, who works diligently to assist Irvine families with obtaining mental health resources in the county. One of those resources is For Families, a city-funded program designed to assist members of our community with stress, depression, substance abuse, family conflict, relationship problems, financial issues, or child behavioral issues. Please call 949-724-6650 to speak to a trained mental health professional. For more information about For Families, please visit the City of Irvine website. Remember, we will get through this together. And now it's my pleasure to introduce the Director and Founding Dean of the Public Health Program at UCI, Dr. Bernadette Boden-Albala.
Hello, I'm Dr. Bernadette Boden-Albala, and I'm the founding dean of the program in public health at University of California, Irvine. And I'm really happy to be here today to talk to you, residents of Irvine, California, about COVID-19. So let's talk first about where we are. So as of this morning, we had 882 COVID-19 cases in Orange County, 77 COVID-19 cases in Irvine with no deaths, and 14 COVID-19 deaths in Orange County overall. We're seeing that the virus is doubling at about a 3 to 3.5 day rate, and that means that if on day one you started out with 200 cases, that in 3 days it would double to 400. So what does all this mean? What about the COVID-19 cases? Let's talk about testing. So, in Orange County, as of today, the total number of people tested by the public health labs and by commercial labs in the area, including testing sites at Hoag and at UCI Irvine, is about 9,933. The healthcare agency public health lab has kits right now available to test about 990 additional specimens, and then should be expecting to get more kits. Currently, at UCI, we're testing about 300 a day on 2 different kinds of platforms. One test is a 2-hour test, and the other test is a 24-hour turnaround test. And that means depending upon which of those platforms, you may hear in the same day or the next day. Over the weekend, we're anticipating bringing that 300 up to 400 with 2 other rapid platforms. So 400 then a day. And we'll be providing some serological or antibody testing soon. So that means very soon we will really be ready to test many more people than we've been testing in Orange County. And we'll be able to do 2 different things. One, we'll be able to tell using these kind of tests if you've been diagnosed with COVID-19. And the second thing that's really interesting and important is we'll also be able, when we get antibody tests running, to see if you've actually had COVID-19 and didn't know it, or just had very mild or moderate symptoms and did not have to go to a hospital. And that gives us a really good sense of how the virus has spread in this community. One of the things I want to continue to warn you all about, which everyone's been warning about throughout the United States, is that since we really weren't prepared for such an outbreak, 9 months ago, that we do have reagent shortages for both kinds of tests. And I think that's one of the big issues about why we haven't had as much testing of COVID-19 in Orange County, is really because we've had a reagent shortage, and to some extent, some other testing supply shortages. So what about testing, though, overall in the United States, and where are we in Orange County compared to that? So we hit in the United States, we hit over 1 million tests with about 334,000 people positive for COVID-19. In California, we've done 116,000 tests, 13,483 were positive. So we're really not, we haven't tested as aggressively as other places, I think primarily because of shortage, and also because it takes a while for labs to get up and be ready. So thinking about this, who should get tested and how does it work? And I think it's really important to understand this. Shouldn't everybody get tested? And you know, in the perfect world, yes, everyone should get tested. But right now, because we have limitations on reagents and other things, we really want to test people who are very ill. We need to know when they're in the hospital, if they are, or in the intensive care unit. We need to know if we're dealing with COVID-19 or something else. And you know, overall, it looks like about 80% of people who get COVID-19 will stay home, will either go from not even knowing they had symptoms, although still being able to spread this, all the way to feeling like a really nasty flu. And then the rest, the other 20%, hospitalized, needing care, being put into an intensive care unit. And so who should get tested? The people that are feeling very, very ill. So remember, we're all social distancing, we're all staying home. But if you're feeling really ill, you should call your doctor and arrange with them. Speak with the doctor and make sure that you're both on the same in the same place. And if he wants you to get tested, then you should go to one of these drive-through centers, and they'll let you know which one to go to. And everybody else, I think we should just wait, I think, for the antibody testing. So we're talking about when is this going to happen and preparing for a surge in Orange County. So I wanted to give you a little sense where we at UCI and at Hoag, we're collaborating with the Orange County Healthcare Agency, and so we just wanted to give you some updates. So all hospitals in Orange County have activated their surge plans to support a COVID-19 prep and response. What does that mean? It means that we're screening all visitors and staff into hospitals. It means that elective procedures have been canceled. It means we're utilizing the ORs and pre-op areas for surge, just so that we can accommodate more people who are very sick and may require a lot of care, including things like high-flow oxygen and ventilators. We're expanding our critical care and medical surgical beds, and you may see a lot of tents around hospitals, and that's because these are surge tents to help us screen the very sick from the sick and also take care of overflow. Just these efforts alone in the last week have increased the available bed capacity in Orange County by 21%. And for you all in Irvine, Hoag, UCI, and Kaiser are on top of this and really making sure that every person who needs medical attention can get that. And so what that 21% surge, 21% increase means that we now have over 1,000 ICU beds in the county with a total available bed capacity of close to 6,000. So I wanted to show you, everybody's been talking about models and curves and predictions, and I think the question I get asked most is, when is this going to happen? And there's a lot of things, a lot of variables that go into these predictions. And this is a prediction out of the University of Washington, Seattle, and they have an excellent biostats group there. And so they're predicting for the state of California that while it looks like we're up on the rise for a surge kind of hitting right around April 20th. It looks like they feel, based upon modeling, that we're actually going to be under that critical point of needing beds that we don't have. And that's really very, very reassuring. Another model that we're doing here for Orange County, and I want to draw your attention to the model that says straight scale, and I want to draw your attention to the model, the straight scale line that is in yellow. That's really the sort of the scenario that we think realistically we're going with. And again, some of the variables have to do with how many people we think are going to need intensive care, how long they're going to stay in the intensive care unit, unit, what are the ages of the people. But again, I think we're looking at this April 20th date, somewhere around that, in order for us to sort of pinpoint when we're beginning to do surge. I wanted to end with something that the chief and the mayor have talked a lot about, and that's this social distancing and the social distancing and other kinds of preparedness interventions. So one of my colleagues at UCI, Professor Daniel Parker, did this model. And what's really interesting about the model is the gray lines represent, or the gray curve represents no intervention, so no social distancing, nothing. The green, and you can see that that's close to 20,000 cases of COVID-19. If we look at the green line, we get this huge dip, maybe of about almost 10,000 cases, 7 to 10,000 cases difference by being socially distancing for at least a month. If we were going out to 4 months, we'd see further reduction of that, and maybe almost 10,000 there in terms of confirmed cases of COVID-19 that we could prevent. So it's important, to think about these curves, because we're all in there, we're in our homes, we're dying to get out, and it's all about these preparedness behaviors. So whether it's socially distancing by staying in your home, or whether it's talking with friends via Zoom as opposed to having you and your kids go out and meet your friends in the playground, or whether it's washing your hands to ABC or happy birthday, we're all in this together in Irvine, in our community, and we have to be together in order to reduce COVID-19 and protect ourselves and others during this global pandemic. Thank you very much.
Thank you so very much, Doctor, for your information and your charts. We very much appreciate you being here today. I would like to thank all of our guests who spoke here today as well. I would like to thank our residents for your patience, for your understanding and participation during this very difficult time. I would like to ask all of you to take care of yourselves and your families, and to turn to us at the city if you have any need of resources or anything in the near future. We are here to help you, and I am Mayor Christina Shea, and thank you so very much for watching us.